Hi there. Welcome to the Lifestyle Herbalist podcast, where we hope to bring you a healthy dose of happiness. I'm your host, Dabney Vaccaro, clinical herbalist, health coach, lover of plants.
And I'm Sabrina Cooper, registered culinary holistic nutritionist and herbalist. Join us as we dive into the art of herbalism, mindfulness, and healthy lifestyle practices to help you achieve a happier and healthier life. Whether you're a seasoned herbalist or just starting your wellness journey, we're here to provide you with the insights, tips, and inspiration for a more balanced and joyful existence. So grab your favorite herbal tea, sit back, and let's get a healthy dose of happiness together.
Hey, welcome back. I am Dabney. I'm going to be your host today, and I'm going to talk to you all about oral disease. As a trained dental hygienist, I've been working with patients for over 20 years. I have lots of clinical experience, and I currently still work in the clinic with patients. One thing I have noticed throughout my career is that there is still disease. We are the preventative agents as dental hygienists. We are trained to help people understand and coach them along so that they can do something differently in their oral cavity to mitigate the expense and the time that they have to spend going to the dental chair for a restoration or gingivitis or periodontal disease. And we do treat those things. Those are things that dental hygienists treat. We treat gingivitis, we treat periodontal disease. But what makes it happen in the first place? And we're going to talk a little bit about the root cause. And I've got lots of information as an herbalist about natural ways to help you understand and maybe even heal your mouth. So stay tuned. We are going to be diving into this very soon. As a dental hygienist, as an herbalist, as a health coach, I've been able to put all of these things into practice to help my patients better understand their own oral health and to help them be able to make good, solid changes to promote more vitality and better oral health outcomes. According to the CDC, though, sadly, in 2024, oral disease still affects a significant portion of our population here in the United States. 47% of adults have some sort of periodontal disease, and nearly 90% of the ages 20 to 64 have even experienced some form of tooth decay. Half of the children aged 6 to 9 have cavities, and in addition, 25% of U.S. adults over 60 have no natural teeth. Can you imagine not having your natural teeth? And I have encountered many folks who have just given up on their teeth and decided they just want them all out and they want to get a denture. And while it's true they won't have any more gum disease, they won't have any more cavities, having a denture moving around in the mouth just gives you another set of problems. They're not the same problems, they're just a different set of problems. So I hope today you'll be able to understand maybe what the root cause of some of this inflammation is, some of the root causes of cavities. And sometimes I think about like my patients who I've seen in the kiddos and, they just don't want cavities. And we don't get as upset as we should about cavities. The doctor comes in and I have to say I've done the same thing, is to minimize like, well, you have a cavity. We'll get you back in here. We'll take care of it. Do you know what causes cavities? I can ask those questions, but we really should make it a bigger deal. Like it's a loss of a tooth structure and it just sets that child up for more tooth problems in the future. A filling only lasts so long and then it has to be replaced. And every time it gets replaced, that filling gets a little bit larger. And depending on where it is, it can actually, over time, fracture the tooth. So, which then could lead to either needing a crown, which is expensive, or even a root canal, which can be expensive, or even tooth loss. So, if we could just keep our teeth and the structure of our teeth without disease, wow, that would be so much better. We have come a long way. I have to say, I work near a retirement home, and a lot of my patients are from this retirement home. They are so much fun, and I so enjoy seeing them. Many of them still have most of their teeth, and it's so wonderful to be able to care for this population and know that they have put such effort into taking care of their teeth and know that that their teeth are important to them. So, okay, let's talk about sugar, because here's the thing. That sweet little villain isn't just giving you cavities. It's basically throwing a rager party in your mouth. And that's where the bacteria are the guest who never leave. And guess what? They wreck the place. But before you panic, I've got your back with some seriously powerful herbs that can kick those troublemakers to the curb. Think of them as your mouth's bouncers. There's Neem, there's Clove, there's cinnamon, and there's more. So let's dive in. So here's how sugar betrays you. You take a bite of something sweet, and those Streptococcus mutans, which are the main cavity-causing bacteria, they throw a party. They eat the sugar, they poop out the acid. Gross, right? I know. And that acid eats your enamel. But wait, it gets worse. Sugar also flips the switch on inflammation, turning your gums into red, puffy mess. And that's how gingivitis starts. And if it sticks around, hello, periodontal disease. Basically, sugar is that friend who ruins your house and your mood. Not to mention your wallet. But it's time to call in those reinforcements. There are some herbs that can really be game changers for the mouth. I want you to meet Neem, N-E-E-M. This is an ultimate gum bodyguard. It's like, nope, plaque, you're not setting up shop here. You can chew on a neem twig, which is old school Ayurvedic style, or you can grab some neem toothpaste, and you can find it at herbal stores. Cinnamon is not just for lattes. It actually murders bad breath bacteria and makes your mouth feel like a cozy fall day. Try swishing with cinnamon tea. And then there's clove. That will fix a toothache. And actually, for folks who have had a dry socket, it's actually the oil of cloves that's actually put into that socket. That is part of that dry socket material that helps with the pain. Clove oil is your instant chill pill. Plus, it's antibacterial, like a natural little hitman for germs. I love licorice root. It's sweet and it fights cavities. Yeah, it's like a double agent of herbs. And then there's my all-time beautiful flower, Calendula. It's a gum healer. Not only does it make your skin look radiant, if your gums are throwing a tantrum and they're literally angry in there, Calendula tea is like a warm hug for your mouth. It's soothing and it's moisturizing. It's wonderful for the mouth. Chamomile is a gentle giant. It calms angry gums and it helps with canker sores. Basically, it's Xanax for your mouth. What more could you want? Plus, if you have clenching and grinding or tension in your jaw, chamomile is one of those herbs that can help mitigate some of that issues that you're having. Then we have oregano and rosemary. They're just not for culinary purposes. These two are a dynamic duo of germ killing. A drop of their essential oils and like some coconut oil makes a killer, literally oil pulling mix. Speaking of oil pulling, it's not just some weird TikTok trend. It's been around for thousands of years in Ayurveda. Here's the deal. You swish with the oil, like coconut or sesame, in your mouth for 10 to 20 minutes. Yeah, I know it seems like a long time. And it acts like a magnet for bacteria, plaque, and even toxins. Think of it as a detox car wash for your gums. It works because the oil binds to the nasty stuff like biofilm and bacteria, and water can't grab that out of there, but the oil does. It reduces plaque and gingivitis, and we actually have studies to back this up. It whitens teeth gently with no harsh chemicals. So pick your oil, like coconut, which is the most popular and a milder taste. Sesame oil is the most traditional, but it is a little bit more flavorful, let's say. You scoop about a tablespoon of the oil. You swish gently, don't gargle, for about 10 to 20 minutes. You spit it into the trash can, not your sink, because oil clogs the pipes, and we don't want clogged pipes, right? That nobody wants that. Then you can rinse with some salt water, then brush as usual. Do this just 3 or 4 times a week. In the morning, before meal, is ideal. So, if 20 minutes sounds like a marathon, just start with 5 minutes and work your way up. Your jaw will adapt. But I was talking to you about oregano and rosemary. So this is a germ-killing squad. These 2 herbs aren't just for pasta sauce. They're the secret weapons for oral health. It is the secret sauce. Here's why. Oregano oil is packed with a compound that actually obliterates bacteria, even the kind that causes gum disease. And rosemary, well, it contains an acid which fights inflammation and plaque like a ninja. So this is how you use them. First, you're going to add 1 drop of oregano essential oil and 1 drop of rosemary essential oil to 1 tablespoon of coconut oil. You're going to mix it really well, and you're going to swish as usual, but do not swallow. Essential oils are very potent and can be very damaging to your liver if you swallow them. So swish, 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 and then you spit it out. And here's a mouth rinse idea. You could also steep, which is what I usually recommend, steep fresh rosemary and fresh oregano in hot water for 20 minutes. Essentially, you're making a tea. You're going to strain, cool, and then swish. And I've had plenty of patients who have used this and have found it to be beneficial to their gum health. Even maybe steeping a couple cups of it and keeping it in a refrigerator, and then just take a hit of it and just swish it once a day. And that way you don't have to make it as often or every day. The other thing with oregano oil, with the coconut oil, is that you can mix the 2 together and rub it on a gum area that tends to be a little bit more tender. It's great for gingivitis, but you can just rub it in there like a little massage, and it can be very helpful for a specific area. Maybe you cut your gum with some floss, maybe you cut it with a chip, maybe your gum's just tender in an area, but you can use a little bit of oregano oil and some coconut oil and just massage it into that area for healing. I will warn you though, oregano oil is very strong. You always want to dilute it, never use it straight on the gums. It'll burn. It's basically like a chili pepper for herbs. So, once upon a time, I had a patient. She still comes to the practice, but because I'm only there part-time, I don't see her as often as I used to. But I remember one time she came in and her gums looked so much better. And I thought, what have you been doing differently? I was like, your gum tissue looks different than it normally does. And she goes, well, I read about oil pulling and I've been using oil pulling for the last several months. And I was so interested to know if you would notice a difference. And I was like, well, I do notice a difference in how your gums look. So I had proof positive that somebody who was using oil pulling, it was actually working. The other thing I think is that it makes people more aware of their oral cavity and their oral health. So after the 10 to 20 minutes of swishing, they're then using the toothbrush, they're using something to get in between. And so they're spending more time. And I think that's the root of it too, is just spending the time and investing into the practice of oral health and just their routine. So while oil pulling has some benefits, spending the time to take care of your teeth and your gums certainly is just as important as anything else. So let's get a game plan for your mouth. Here's how to use these today without turning into an herbalist wizard. Thank you very much. I am an herbalist wizard. So in the morning, you can brew some cinnamon and rosemary tea, let it cool and swish. Boom, morning breath and bacteria, gone. After meals, have a bag of a few fennel seeds and some licorice root that's chopped up. You can throw a couple pieces in your mouth and just chew on that after meals. It's like a toothbrush. If you can't get to a bathroom to brush your teeth, it'll help clean your teeth. And before bed, because typically we have a little bit more time before we call it a night, That's when you can do your coconut oil pulling. You can put some herbs in there, like some clove or oregano or neem, whatever you have on hand or decide to use. But remember, you're going to swish for that 10 to 20 minutes. You don't have to be in a bathroom. You can walk around the house. You can do some other things. You can tidy up, whatever it is you need to do to take your mind off of it is perfectly fine. But herbs are not a free pass to mainline candy. Just because you're doing these herbs and doing all of these things doesn't mean you should still keep having sugar. Sugar is the cause. It's the root cause of many of our systemic things that we will talk about later on in future podcasts. But you want to clean your teeth well. You want to use something to clean in between the teeth because the brush does not get in between the teeth. That is just the way it is. Our teeth are too close together and they're like little boxes, and there's no way the little bristles of the brush is going to clean out the stuff that's in between. And we just don't want to feed the bacteria. They're like gremlins. Never get them wet. Never feed them after midnight. Wait, no, sorry, that's something else. Just don't feed them sugar, okay? That's the culprit. Sugar is the bad guy. That being said, I will say that xylitol, which is a 5-carbon sugar, is dearly loved by most or all dental providers because it actually does not feed the bacteria. It actually, what it does is it breaks up their communication. And so they get confused and often leave the communities that they were living in. So it can actually help clean your teeth as well. But you need 100% xylitol in either your toothpaste, your mouth rinse, your gum, your candy, whatever it is you're using to try and mitigate the acids. And plus it brings our pH up to that 7-point basic area, which was what we need so that we don't have an acid invasion going on, which breaks down the enamel. Our saliva is basic, and which means it's above that acidity level. And that's what xylitol is designed to do. All right, team, which herb are you going to try first? I want to know what your herbal mouth care experiment is going to look like. Tag me. I want to see it. We're going to keep talking about oral health for a little bit, so this is the real deal. This is not TikTok hype. So until then, keep smiling herbally. Until next time, take care.